Welcome back to the show. Many thanks for staying with us. Well, we may lose the fight against HIV and AIDS if we fail to allocate more funds. This is the warning coming from People for Health, an organization that has conducted some research into how much funds are allocated to MMDAs to deal with the disease. They put that study together with St. Ghana and are recommending that the allocation in the District Assembly's Common Fund be increased to 2%. Ademo Mukaila is a civil society advisor with USAID, and he joins me in the studio more. You're welcome.
Thank you very much.
Let's start with how the state of affairs when it comes to the spread of HIV, because the last time I remember former President Mahama said that we're actually winning the fight. It says that the prevalence rate has stabilized or something like that, if I'm getting it correct. What's the state of affairs?
Thank you very much. Generally, we have a low HIV prevalence rate when you look at other countries within the sub-region. That's below 2%. However, that is for the general population. But there are sub-population that we have a very high prevalence rate. If you don't take care, we all end up getting the HIV. If you take the KP, if I say KP, I mean men having sex with men.
Okay.
HIV among them is about 17.5%.
Men having sex with men?
Men.
Okay.
It's about 17.5%.
In Africa?
No, in Ghana.
Oh, in Ghana?
Yes.
Okay.
And if you take the general population, it's below 2%. So looking at general population, say, okay, we are winning the fight. But if you consider the subgroups, like men who have sex with men, it's about 17.5%. Commercial sex workers is about 11.5%. Then if you look at this subgroup, then you say that we have really a challenge as a nation to deal with.
Is this an improvement on previous statistics?
Well, that is not an improvement. If you consider the last 3 years, HIV has been increasing. For instance, in 2014, it was 1.6%, 2015, 1.8%, and currently it's about 2.4%.
So it keeps,
it means that it keep on increasing.
But why?
It means that we have relaxed in a way.
Okay.
In terms of even commitment. No, most of our HIV funding is coming from donor funding. If you take 2012, for instance, about $109 million was actually made available for the fight against HIV. Government of Ghana contributed only 4.1% of that. Then the amount reduced in 2013 to $67 million, from 109 to $67 million. And in that year, government increased its contribution to about 2%. And in 2014, about $68 million.
So it keeps going down. It
exactly.
sort of fluctuates, the amount that government is pushing in.
And government puts in only 7% of that amount. And if you consider the fact that donor funding is also coming down, then we need to do something about it if we really want to reduce HIV.
But the education has been quite extensive.
Yes.
I mean, we've had to deal with other things like Ebola, etc. But then the education, especially about HIV and AIDS, has been quite extensive.
Yes.
If we're still pushing in money, I mean, if it's even a reduction from $109 million to $57 million, like you say, it's still some form of investment into it. Where is all of the money going?
It's going to HIV programs, but the issue is that people are not prepared to change their behavior. Well, even though education is very high among Ghanaians, but that kind of behavioral change is not there. People still consider HIV as, I mean, something that is not even there.
Quite distant.
Yes. Yes.
So from this research that has just been conducted, what are the recommendations? Because if people are not willing to change, then that is rather the problem, rather than the issue of monetary support from government.
It's both, because currently Ghana is implementing the 90-90-90 target. What it means is that at least 90% of persons living with HIV should know their status by 2020. And out of that, those who are positive, 90% of them should be receiving treatment.
Okay.
And when they receive treatment, we expect viral suppression. 90% of them having viral suppression.
What does that mean?
What it means is that if you reach that stage, even if you have sex with somebody,
You
the
cannot
person,
transfer the disease to the
yes,
person.
the viral rate is very low that
Low.
you can't transmit it to any other third person.
Okay.
So that is the target that we are looking at. And that calls for a lot of investment. For instance, if you are talking about testing, it means that we have to make a lot of test kits available. So if you are not making the test kits available, how will people know their status?
Yeah.
So that is the issue. If you are not making the antiretroviral drugs available, how will people get treatment? So we still need to invest a lot if we really want to eliminate HIV by the year 2030.
Okay. You mentioned that people are not willing to change their lifestyles. I'm finding it a bit difficult to understand, because if you know that this is something that will kill you, why is it? I mean, I don't know if there's been any studies, but why is it that people don't want to change their lifestyles? Well,
it's something that we need to do a more research into to find out why people are not. But some people do not even believe that HIV exists, to be honest with you.
So what did your research find about the reasoning behind the people?
No, we didn't go into that aspect. Okay. We just looked at the funding of HIV program, especially at the district level. So if we have this situation in our hands, then it means that definitely something needs to be done. Especially at the district level. And then currently, if you look at HIV spending at the district level, it's just the 0.5% of the district assembly common fund, which is allocated for HIV programs in the district.
That's 0.5%. So
of
now
the
you're
district
advocating
assembly.
that it should go to 2%.
Yes, yes. If you take the 0.5, averagely, assembly gets below 10,000 Ghana cedis a year for HIV programs. What can 10,000 Ghana cedis do?
But then has there been research to indicate or to prove that the 10,000 that went was actually put to, you know,
yes. Our research finding also indicated that at the district level, even though the money is too small, but there's some misappropriation of even the small amount that we have at the district level. So that was one of the findings.
Any names, any information? So
well, some of the, we did a study in 15 districts in the northern, eastern, and greater Accra region. And at least 2 of the 15 districts, clearly audit findings indicated that they misapplied the funds. And out of the 11 districts that provided data, 4 of the, almost all of them did not comply. There's a guideline as to how to use the money. They all didn't actually comply with the guidelines. Some were spending over some thematic areas, others were underspending. So,
what are your recommendations then?
Yeah, we want government to increase HIV funding, more specifically the 0.5% to 2%. What we are thinking that if that is increased to 2%, at least the district will be able to implement their work plans in combating HIV at the district level. We are also saying that districts with high prevalence HIV rates, they should devote at least 5% of their internally generated funds to fight HIV. We cannot leave the fight of HIV in the hands of donor organizations.
Did you make...
yes.
Please go ahead.
And now if you look at the donor funding, it's coming down from 79% to 60%. Somebody needs to fill that gap. And that is why we are calling on the government to fill that gap.
There shouldn't have been the gap in the first place if you ask someone. But then, did your research recommendations ignore the misappropriated funds, the fact that the aspect that people have been, some of these funds have been misappropriated by district assemblies, and that some of them have been diverted into other programs, that some have not been used at all? Did it ignore it totally, or did you have any recommendations?
We made a recommendation. We are asking government, especially Parliament, to look at the audit reports and sanction assemblies accordingly. It's not just coming out with the audit report, people have misapplied, misappropriated funds, and that ends it. We should ensure that we sanction those assemblies to ensure that at least it serves as a deterrent to some of them.
Moving on, what's going to happen? Now you've done this research, you have this information out there, you have these recommendations. We here will put it out there in the media, but then what's the next step as the organization?
We are going to embark on a 3-year campaign to ensure that government of Ghana increase it from the 0.5 to 2%. And like I indicated, we are also going down to the assembly level to ensure that at least those with very high HIV prevalence rate, they devote at least 5% of their internally generated funds to the fight against disease. Now, even if you look at government funding, to Ghana AIDS Commission. In 2014, for instance, the total budgetary allocation was about 31 million Ghana cedis. As we speak today, it's about 9.8 million Ghana cedis, which means that as a country, we are not even committed. If you can reduce from 31 million Ghana cedis in 2014 to 9.8 million, and out of that 9.8 million, 82% of that is going to meetings and seminars.
What
and
did
the other 18.
What did you find that they did in those meetings and seminars? I mean, not to look down on it, but what is it? How important was it? What did it add to the fight against HIV?
That is the issue that we are raising. And then the other 18% is going to payment of salaries. So which means that in the area of stigma and discrimination, which is preventing the fight against HIV, is an area that has been ignored totally.
I see. Yeah. I see. Have you engaged the AIDS Commission on this?
Now that we've launched the report, the next stage is for us to have engagement meeting with the key stakeholders at the national level, not only AIDS Commission, but the District Assembly, Common Fund Secretariat, Parliament, as well as Ministry of Health, and then the National AIDS Control Program, so that we can see the way forward.
Okay, but at least what we can say for sure at this point is that monies that are meant for fighting HIV/AIDS is probably not getting to the people.
It's too small in the first place.
It's too small in the first place, and the little amount that's available isn't reaching the target.
Exactly.
Quite unfortunate. But thank you very much for coming through to the studio. Ademo Mokaila there speaking about the fight against HIV, and it looks as if it's stabilized, but from what he's just told us from their research, it hasn't, because the prevalence just keeps rising from 17.5%. It went down to 1.6%, went down to 1.8%, and then it went up again to 1.8%, and of course that's not a good thing. Looks like a bit fluctuating statistics there. Obviously not a good one.